Welcome back to Local 3 News. It's Aspirus Medical Monday, and with May being National Stroke Awareness Month, joining us via video chat is Ryan Bezalo. One of his titles includes being the Stroke Readiness Coordinator for Aspirus. And so to begin, what is a stroke?
A stroke occurs when the blood supply to part of the brain is interrupted or reduced, and that prevents the brain tissue from getting oxygen and nutrients that it needs. And those cells then become damaged, causing the brain to not essentially function appropriately.
What causes a stroke?
Strokes are caused by two main factors, either a blockage in the vessel within the brain or that leads to the brain, or the reduction in blood supply to the brain from another cause, such as bleeding somewhere else in the body. And then we also have a rupture of a major vessel in the brain, and that would be our hemorrhagic type strokes.
What are signs and symptoms of a stroke?
Numbness or weakness or even paralysis, and often this will occur on just one side of the body. So you may see a facial droop, weakness or paralysis of one arm or one leg, trouble speaking or slurred speech, or trouble understanding speech, confusion or changes in level of consciousness, vision problems, and sometimes this will occur in one or both eyes, where vision may be blacked out or blurred, troubles with coordination or walking or the inability to walk, major dizziness, or the other thing that a lot of people report is the worst headache of their life. So no real cause to that headache, but a sudden onset of a very severe headache.
Why is time important when addressing a stroke?
Strokes are very time sensitive and will affect the outcome. So the sooner a patient suffering from a stroke can get medical attention following the onset of symptoms, the greater chance of successful treatment and less long-term standing effects. So healthcare providers' immediate goal is to identify that a stroke is occurring. And we do this through mainly diagnostic imaging, so a CAT scan, to identify what type of stroke it is, where it's happening, and then also with very detailed neurologic assessments done by qualified healthcare providers to identify if this is a stroke that's going on.
What is recovery like after having a stroke?
Depending on the severity of the stroke, patients may require minimal to extreme therapies. This could be short-term or long-term, just depending on that stroke's outcome. Our goal is always to get patients back to a functioning level of lifestyle. Some people have little to no residual effects after a stroke, and some people have major disabilities. However, with the use of restorative therapies, this can vastly help in regaining the highest level of functioning. This includes physical therapy, occupational therapy, speech therapy, all those things to get them to the highest level of functioning.